Folks, thanks for coming on the line with us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 45 minutes or so discussing the value of a couple of entitlement programs, low income subsidy, extra help programs, and Medicare Savings Programs that can be of value to you even though you don't target the lower end of the Medicare market. Today's presentation is being recorded, and it, along with a number of articles and other reference material we'll allude to through the course of the presentation, will be sent to everyone who has RSVP'd to today's presentation. So watch for that, hopefully a little later today, tomorrow at the latest. It'll include a link to today's recording and a PDF of today's presentation. The programs that are available to the Medicare population that are on the lower end of the income stream can be very helpful to agents across the board, regardless of whether or not they concentrate on that edge of the market, simply because of a well-known turn of phrase called numbers. And simply we'll go through and discuss that in greater detail in just a moment. A little bit of background about Premier Marketing to start. We're a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We have offices across the country and act as an insurance wholesaler, providing insurance contracts to independent insurance agents at the highest possible commission levels and with recruiting contracts available to those who qualify. I mentioned we were founded in 1968, so that means this past year we celebrated a milestone in our history, our 50th anniversary, which is quite an accomplishment for what began as a small family agency in rural Nebraska that's become one of the largest producers in the Medicare space for both Medicare supplements and Medicare Advantage programs. We do so through a full portfolio of insurance products that include the different programs for the Medicare population, the Medicare Advantage and Medicare supplement programs, and the standalone prescription drug plans, the Part D programs. And we also offer a full portfolio of life insurance and annuity products, including final expense and pre-need programs, long and short-term care programs, disability income plans, and ancillary benefits, including dental, vision, and hearing programs, critical illness and cancer plans, and hospital indemnity programs. Those Medicare Advantage portfolios that see a lot of the influence of LIS and MSP programs include all the national carriers and a number of the strong regional carriers that can make a difference to you in your market. That same philosophy carries over into the standalone Part D programs, where the national players are available to you through our organization. Medicare supplements, it's a nice, healthy portfolio of products that comes not only with a selection of programs from the name and other carriers, but also allows for you different tools to help you be successful in that space. And it's this area that is affected by a big portion of our discussion today, where folks would think with Medicare supplements being their thrust into the market that the LIS and MSP programs might not have as much of an effect on them as folks who concentrate on the Medicare Advantage or PDP programs. To a degree, that's true, but we're going to talk about the differences and how that can make a change for you in your marketing emphasis. The ancillary products do include all the name carriers in the different areas as well. These folks are very innovative in not only the way that they market their programs, but in the technical support that they supply to the agents that provide these programs. And they're a great cross-selling opportunity for us in the different areas that we investigate. This is where we get into some of the details as to why LIS and MSP make a difference to anyone who basically markets the Medicare niche market in the insurance world, simply because it's such a huge market that we don't necessarily want to just limit ourselves to a portion of it, or in a manner of speaking, turn business away because we're unaware of some of the simple rules that we can use that can help us in our chosen area of focus. we come on programs like this, and marketers such as myself or carrier representatives will speak to the fact that the baby boomers are aging into Medicare, one every 8 seconds, over 10,000 a year, and it's a burgeoning market that really gives us a lot of opportunity for at least the next 20, 30 years as part of a overall market opportunity. And that's true if you go just off of the ages of people becoming eligible for Medicare. But that's not the only segment of the population that is on Medicare. And just because someone turns 65 nowadays, that doesn't mean that they are accessing their Medicare benefits necessarily. There are a number of folks that are continuing to work past the age of 65. Many of them are deferring their enrollment into Medicare Part B and accessing the benefits that they have now access to because of their age. And so it's something that we can't go off of with a sheer number just by people turning 65, because there are also people that are disabled and accessing Medicare benefits, and it's a huge number as well. And this gives us then different possibilities across the board and affects our marketing emphasis as well when we look at the Medicare population. It's a population that has a lot of different characteristics that ask us basically to have a portfolio of products and a scope of knowledge on different programs such as low income subsidy and Medicare savings programs, so we can properly address the market. And it's interesting to note too that even if we target the higher end of the income strata in this population, not everyone we visit in a household may be part of that income stream. There are many circumstances where parents now are living with adult children or accessing other members of their family for a place of residence. And so accessing a prospect just based off of one means of reaching out to them through different marketing strategies doesn't prohibit you from having other opportunities within that household with other individuals that have entirely different statistics behind them. We see overall that a number of the Medicare population has chronic illnesses. So it is important for us that if we approach this population on the turning 65 area, that we are very aware of the guarantee issue opportunities that we have with Medicare supplement programs, but also the opportunity to enroll someone when appropriate in a Medicare Advantage program, simply because the second category may come into play. The median income for a Medicare beneficiary in this year's statistics, this 2015, is $24,150. Later statistics, and we'll see that in just a moment, that's gone up a bit to $26,200, but you still have a good portion of the population that may not have the funds available for what they may view as their best choice on a Medicare supplement, unless there were some other programs that you could use to help free up dollars. And so that's part of the approach that we look at with some of the programs that are available to help people with the cost of perhaps their prescription drug programs or other expenses that they have in the Medicare health insurance arena. Bear with me just a moment. There we go. Here's that later statistic that I was talking about. You'll see, of course, that a good portion of the population has a lot of health challenges. And in certain circumstances with a Medicare supplement program, if it requires underwriting, we don't have necessarily programs that will allow for those conditions. So being aware of some of our other opportunities helps us make certain that we're able to maximize our sales and the number of people that we are able to help in this portion of the Medicare population. Because we'll also see that because of the different demographics, how they affect people at different ages, this may also play a key role in how we approach the population if we go at it with more of a Medicare supplement bent. It gives us then the idea of different age stratas that have a higher probability of having the funds available to actually purchase a program that has a healthy premium in certain circumstances because of their age, or may have other opportunities because of the assistances that we have with helping them with their prescription drugs. So as we make our marketing programs moving forward, looking at AEP and beyond, because we can enroll people year-round depending upon their circumstances, having some of this detail can be really helpful in pursuing the market that is our focus. This gives us that number that I was referring to just a bit ago, where the median income is a bit higher, but there is a portion here that may still desire a Medicare supplement program that has a premium, but these people may be in the target demographic for assistance, at least on their health care needs for their prescription drugs. So it also gives us an idea then, if we are marketing with a Medicare supplement to sell other products, including life insurance and savings programs, it gives us an idea of where those assets are as well. Across the board with some of the same statistics that we saw for income a bit earlier here with the per capita savings. Because folks do have options as they go into Medicare, and we are seeing different folks approach the market differently. And to be honest, when you go into a doctor, if the doctor just handed you a pill without asking any questions or doing any tests, you'd look at them with a bit of a jaundiced eye, to say the least, and realize that there has to be a diagnostic procedure, in a manner of speaking, that goes about to help determine the best course of action moving forward. People who receive Medicare benefits, well, they have a number of choices. One of the first ones that's not really listed on this little slide here is the fact that they can self-insure. They don't have to do anything additional. But because original Medicare doesn't have a stop loss and does have deductibles and co-insurance to deal with, they have to be prepared to come out of pocket for that. Folks do, of course, have the option of staying with traditional Medicare administration and pick up the standardized Medicare supplement programs that can help with the medical expenses, pick up that Part D program for their prescription drugs, and depending upon where their income flow finds themselves, there may be programs to help them with the costs of those drugs as well. That's part of our discussion in just a little bit. And then, of course, people can choose the Medicare Part C programs where private insurance companies administer their benefits, many times bundling the prescription drug coverage right into that same program. It's interesting to note that a number of insurance agents on one end of the spectrum or another become very, very enthused by their choice and not necessarily what may work out best for their prospect, simply because of their deep belief in programs that they offer. And that, of course, is part of what gets us out and going each and every day. But we also have different challenges as agents when we look at the programs that are available in these two main thrusts here, in the fact that one doesn't require as much certification and also has different constraints put upon it when it comes to marketing. So there are obviously reasons beyond just personal beliefs as to what may be best for an individual as to what all programs we offer. Because we're seeing with different research programs that people are making nearly an even split when this choice is first presented to them. You'll see a pretty even split with the Medicare Advantage and Medicare Supplement markets, and then you got a portion, well, they decide, as an old sales manager of mine at Prudential years ago said, the decision to make a decision is a decision. They do nothing. They stay with that self-insured product. Part of this decision may be influenced by, of course, the almighty dollar, and having information available as to the assistance programs can help ease and the decision that people have between those two types of programs as well. So we're seeing that split pretty even across the board over the last few years as well. And what we see in the Medicare supplement world, of course, is the higher income people tend to gravitate toward those programs for a number of reasons. One, of course, that freedom of choice and the lack of a constraint of a network is a really big factor that comes into play, but also the dollars involved gives us an idea as to why someone may choose one program or another. And then, of course, that is a different factor for those under the age of 65. These individuals don't have as many solid choices in the Medicare supplement world. In most states, that choice is that Plan A. It tends to be a bit expensive and doesn't cover a bit either. And so it is an area there then that also speaks to us as insurance agents to have within our portfolio multiple products to cover the spectrum of the folks with whom we visit, because they are across the board, basing on income and other constraints, a solid prospect in one area versus another. So you've got a lot of detail here as to the size of the market and why someone would want to have an awareness of these assistance programs when they are targeting higher income individuals. Well, that basic, simplest answer to that question, why would you want to have that information outside of the obvious, is the fact that it greatly increases the numbers of people with whom you can visit and have a solid opportunity to accommodate their healthcare needs. We see some different changes that have been brought about in 2019 in the enrollment periods, which have a factor or plays a factor for us when we look at all the products that are part of our portfolio. Medicare Advantage programs, of course, you see certain time periods when you can change coverage, and we're about to go into that AEP period coming up a lot quicker than we care to think, about a month and a half now, 2 months, where not only is that the time period where all people on Medicare have the option to change those types of coverages, we also see the greatest activity in the Medicare supplement world as well. And the vast majority of people on Medicare may well qualify for a special election period. So having some of this detail now can help you in September, October, and November before we need to go into 2020 benefits altogether. So some of those changes brought about by legislation in the near distant past has changed some of the folks on the low end of the spectrum, where the SEPs have gone from a continuous SEP each and every month to a quarterly SEP. And right now we're kind of in a period where the dual individuals and the folks that have enrollment periods granted to them, special enrollments period granted to them because of low income, that are in approaching the fourth quarter where they're subject to rules like everyone else. So having that change once a month and knowing some of those differences, it can make a big difference. One of the things that we see as well is a lot of the folks that we visit with may well qualify for some of these assistance programs and don't have it. Statistics show us that a large number of folks are enrolled in the different Medicare Savings Programs, the 4 different levels, and we'll talk about those in a moment, but there's a significant number of those folks who have not enrolled. And as we visit with people and ask a few simple questions, it gives us then the opportunity that we can serve these individuals, even if they can't necessarily buy a Medicare supplement program, they may well qualify for additional help that allows them opportunities in the Medicare Advantage world which is in many circumstances an upgrade from just traditional Medicare. And we'll see that in different parts of the country, those enrollment rates, depending upon where you are and where you market, that might be a larger chunk of the population than you might be aware of. So having some additional details as to how these programs affect you and the population you serve can be helpful. This slide gives you additional presentation detail in video format on the low-income subsidy programs and on the Medicare Savings Programs, because we're not going to go into complete depth on these here today. Some of the things that this can do, though, in order to bring a value to the prospect, is it does make certain that they are accessing all of the benefits that are available to them. So they are maximizing the programs that are available to them, and they are minimizing their financial exposure. It also gives them the opportunity to address one of the biggest challenges we see in the Medicare world, and that is the cost of medications and those programs. And for us, of course, it makes a big difference because it will increase our prospect pool and the availability of folks that we have a legitimate chance to serve. It also helps us by eliminating some of our competition. And it's not as morbid as that. It's more of a circumstance where when we maximize the benefits they have, agents who don't do this may have the opportunity of someone following them in that does and takes your client away. Outside of the fact that these programs are helping you do what is absolutely best for your prospect, it helps you with your persistency. It's harder for someone to replace your product, whatever it may be, if you've gone through and explored all the possibilities of helping minimize a person's financial exposure. This then gives us an opportunity to enhance the programs that we offer simply because of the additional benefits that come through the Extra Help programs and the Medicare Savings Programs. The Extra Help programs are of particular value to us simply because they not only create that special election period that gives us an opportunity to change plans now, but it also gives us an opportunity then to free up additional dollars and keep other people from providing that service because you already have and taking your people. It does also give you an opportunity to help manage your time, because as we get into the annual election period and we have a number of prospects with whom to visit, helping prioritize who needs to come first, well, it may be as simple as, do we have additional opportunities to enroll these people outside of the annual election period through these special election periods? And this then gives us an opportunity to set our schedule accordingly. And when we provide these services, it really increases the likelihood of the most effective marketing tool we have, and that is that of a referral. When we get into the folks that are part of the demographic that qualifies for the Extra Help but doesn't qualify for a Medicare Savings Program, many of these people have a different mindset than the folks that are a full dual beneficiary, where many of the people who are Medicare and Medicaid have a history of having their expenses taken care of, and they're like, why would I enroll in anything additional when I don't pay for a lot of what I'm doing now? The extra benefits can make a big difference, but the people who qualify in what we refer to as a near poor status have a different mindset and are more likely to stick with you and more likely to refer additional people. If you look at just that component, that the low income subsidy, the Extra Help programs bring to us and the population, it gives us a pretty good, healthy contribution to the bank account on dealing with the cost of medications. When the average annual value of the low income subsidy is around $4,000 a year, and we're looking at the income range that is affected by these programs, That's a big difference in the quality of life month after month. So in addition to making those dollars available, it also provides additional access to different prescription drug programs. One of the things that we try to make certain that you have available to you is an opportunity to do annual evaluations of a person's coverage, and this gives us a way to do so, because prescription drug programs obviously change year over year, and you'll have seen this through your own personal experience, where some of the programs may be very strong one year, the next year not so much. The formularies are subject to change. The drugs that are on the formulary may stay on the list, but they may be placed on a different tier, and so the person has different financial exposure in that fashion. So it's something that using a program such as our Medicare Center program that helps you do a year-over-year evaluation can be very helpful in accessing not just prescription drug coverage, but perhaps the most appropriate prescription drug coverage. The second bullet point on this, when it speaks to the protection from the Part D coverage gap, the donut hole, well, we still have that this year. There's elimination of the coverage gap itself in 2020, but there's still a larger financial exposure during that period of time in the year once a person's expended the dollars that are available on the plan through the initial coverage period. And that can make a huge difference. And believe it or not, we do occasionally run across folks who may have said when the drug programs were first available to them, well, I'm not taking any medication, I'm not enrolling in that, why would I do that? And didn't take into account the late enrollment penalty. Having low income subsidy waives that penalty and can make a difference for those folks that are right on that edge of affording other programs. That special election period, well, we're at the end of August now, we're going into September, but if you're anything like I am, September, October, and November, December, I still have bills, and I still have people I can help. So this is very important for us to have a knowledge of the special election periods that LIS and MSP programs bring to us. And for those folks who may qualify for that deeper assistance with the Medicare Savings Programs, helping them with low income subsidy can actually trigger the process for those programs and give us an opportunity to further assist our prospects and clients, and also give us an opportunity for return sales in the future. Some of the things that we're seeing in the world that is affected by low income subsidy is the fact that the prescription drug industry itself is just a monster. There are medications that are coming available now that can do some wonderful things for us and for our bodies, but they can do some really nasty things to our wallets. And we see in many circumstances different generic medications being repriced or re-tiered within these different programs, and nothing's changed on the drug other than how it is used moving forward and how the companies lay those programs into a different type of tier. This difference, these shifts in the formulary placement can cost an enormous amount of money. Having low income subsidy for those in place, for those who qualify, can make a huge difference. And so having an awareness of this and that base protection we can afford through this entitlement program can make a big difference for the people that we are working with, and can make a big difference as to whether or not they stay on the books for us. Because keep in mind, much as a question that's coming through asks, these are programs that a person has to qualify for on an annual basis. Another reason why we speak to our book of business on a regular basis, and to the folks that we spoke to in the past that didn't enroll with us, that remain our prospects and clients. So that gives us the opportunity to utilize these programs as part of our overall annual review, and to take into account, okay, your drugs, you might still be using them in the same fashion as you did in the past, but they may be costing you different because of these changes. What you'll see in low income subsidy as well are two different levels of help. The folks that have the full subsidy, and these are the folks on the lower income range, right above the Medicare Savings Programs qualifications, but right below that, it's what's the expression? You've got too much of too little, in a manner of speaking, where these people then have different assistance programs that may vary from year to year with their qualifications as well. It's also really interesting to note that because these programs are also based not only on income but assets, but changes in what perhaps they sold a house or something of that nature, selling of an asset, can make a difference as to their qualifications year over year. Another reason why it's important for us to visit with these people on a regular basis. One of the things that's rolling through here is, are you getting a copy of this presentation? Yes, it is coming to you afterwards too. There are some different things that can help us recognize people that have a qualification for low income subsidy or perhaps already have it in place. And these people, even if they have low income subsidy, they may prefer a Medicare supplement over a Medicare Advantage program. And let's face facts, it's their decision in the end. However, this may enable them to afford one or the other. And what this does is it does help with that, not only the cost of the medications, but also with the plan premium. As long as they're enrolled in a benchmark program where the plan is below the LIS premium amount set on a national basis, and it's normally around $30 to $32 a year, it does a number of things for them, paying that premium, knocking out any deductible that they may have. That's one of the reasons why you'll see Part D programs at on the Medicare Plan Finder site or on the different software programs such as Medicare Center. Take into account that if you're basing it just on the premium of the plan, well, gee, the lowest premium plans generally have that Part B deductible. LIS takes care of that for them. It also standardizes their generic and name brand copayments regardless of what the plan says. So it drives down those out-of-pocket costs as well. And that catastrophic limit that you have on just the plan, well, those copays are handled by this coverage as well. This gives you a slide that lays out some specifics for you, not only on the annual eligibility incomes, and we're going to have another one that lays that out for you specifically, but also the assets that come into play, whether or not they have to actually apply for LIS. If they have MSP, they don't. The folks that are at 135% of federal poverty level up to the 150, that's the maximum for this assistance, they do, but there's some simple ways that we can help them with it. I'll show you that in just a moment. It then affects their copayments thusly as well, along with their monthly premium and annual deductible. The folks that are partial, well, it still helps them with the premium either in its entirety or on a sliding scale. It reduces that deductible from what is set on the plan to a set number by this assistance program. It also lowers that coinsurance rate they may have on those inexpensive programs that can be higher than what we suspect. It also helps them with minimizing their out-of-pocket exposure on the copayments by the time they reach the catastrophic coverage. This gives you the details on that. Once again, it speaks to the 135% of federal poverty level, which is the high range of any of the MSP programs, to the maximum income level they can actually have and qualify for this assistance. This is coming to you as part of the follow-up as well. On a single slide, for those of you that are active in the grand state of Alaska, well, it's a little different there. And it's a little different in Hawaii as well. The other 48 states are the previous numbers that we have in play. Folks can qualify for this program and apply for it a couple of different ways. They can go to Social Security's website and complete the application online. You can actually do that as their advocate legally and compliantly. Many of the companies also offer assistance through benefits checkup. Many of the big carriers do that. There's a couple of others that have their own system that help them qualify for this assistance as well. They can still do things on the old-fashioned way, not really granite and chisel, but you still have paper forms that are available. I'd strongly recommend doing things electronically as much as possible because it really speeds up the process. So you also have help through different SHIP programs as well. It's been my experience, once you release your prospect or client into that area, you may not control the ultimate outcome as much by having some of these people help. Remember, online is more helpful or more quickly accommodating the needs of our people, and it's really simple. They ask for some base information on the individual, who they are, where they live, how they're identified through their Social Security number, the income and other pieces that come into play, and they actually get formal notification within 10 to 14 business days as to whether or not they qualify for it. Once the LIS comes into effect, that is an opportunity to change programs. It then gives you an opportunity to reevaluate their drug program and see if the funds available are best used in purchasing a Medicare supplement program or examining some of the Medicare Advantage programs they may have as part of their portfolio. Remember, it's a quarterly SEP now in the LIS world as well as in the DSNP world. Here's some additional reference material on LIS that can be helpful for you, and additional information through the National Council on Aging as to some of the different pieces as well. National Council on Aging actually does a really nice presentation on low-income subsidy that if many of you are considering doing informational or educational seminars now in AEP and beyond in different centers of influence in your community, doing one on low-income subsidy can make a very nice presentation. It is a piece that is available from the National Council on Aging. We have it for you and would be happy to provide it to you as well. So this is a great resource for you, and it's a great way for you to become known in your community and use it as a prospecting tool simply by sharing some of the information that you learn through these programs. Medicare Savings Programs, when you get into some of the areas with the MSPs, you are, of course, entering an area where the folks are less likely to purchase a Medicare supplement program. But they do allow for us then the opportunity to market Medicare Advantage programs year-round. They are programs that are shared by the state and the federal government, and these people have different levels of assistance based on their income. 3 levels that we deal with most frequently are the qualified Medicare beneficiary. These are folks at 100% of federal poverty level. And keep in mind, the statistics here, there's a good portion of these folks that qualify for this help that don't have it. SLMBs, SLMB, specified low income Medicare beneficiaries, created by a later piece of legislation. This is another subset that may well be a prospect for Medicare supplements, but because of where their income lies, more times than not, they gravitate toward Medicare Advantage programs. And qualified individual ones, another area where the benefits between the latter 2 programs are very similar. It's in question in many circumstances as to how these programs are funded by the government. Eligibility is based on income and assets in most circumstances. There are, however, 8 states that do not have a resource test, the assets test. And what you'll see is folks that move from one of these states to one of the others as they age or circumstances dictate, they may qualify for an MSP in their home state if it was one of these 8 and may not in their new state. As someone asked a bit earlier, these eligibilities are redetermined each year. And what these do is they do help with other expenses that a person with this assistance doesn't have otherwise. It can help take care of that 10% late enrollment penalty someone has with Part B, as well as the Part D program eligibility and penalties that they're suspect for. If you are one of those individuals that help do spend downs for a nursing home, keep in mind these are different in the fact that there's no estate recovery in these programs, and the folks that get these programs automatically qualify for the Part D programs as well. They're a determination made by the different states in conjunction with the federal government, and can make a big difference because the QMB coverage not only pays that Part B premium as the other 2 layers of assistance do, but it also helps with the co-insurance and co-payments and opens these individuals up to the special needs Medicare Advantage programs that can be really, really helpful for them with the extra benefits that they have available. Keep in mind, all of these programs do exclude one house and one car, regardless of the value of those assets. And this gives you a nice single sheet as to the numbers that are pertinent for the different levels of assistance. And this then gives you the opportunity, as you do a presentation, to mention the fact that there are additional assistance programs available to individuals, and you can just lay out a number then based on income and assets as a couple. If your income is less than $2,100 a month, a little right in that area, and you have assets of less than right around $30,000, you may qualify for additional assistance in one aspect or another. And it's a great way to create additional discussions as to dollars that they may have for other investments or other ways that you can help them with their overall expenses. Because keep in mind, as we've noted a number of times through the presentation, there are many folks that qualify for these programs that don't have it. A lot of it, well, they just don't know they're out there. Or they may look at the applications and think they're a little bit too complicated to do on their own. Or even if they know there are places that can help them with these programs, they have some challenges of getting to them. And then we are dealing with a prideful segment of our population where they misplace a social stigma thinking that these are straight up welfare programs. They don't want anything to do with that. So you can help in a number of ways, either online, working with Social Security offices, advocate programs through the different Medicare Advantage programs, or become part of the processes themselves. So keep in mind these different programs have different levels of income and asset requirements and different levels of assistance as well. Some of these resources are once again available, much like what we saw with the LIS programs, through the different government programs, the different programs available through different insurance carriers, and the National Council on Aging. Some of the things that we can do for you as well with working through us at Premier, in addition to those presentations that I visited with you briefly about, those PowerPoints that are available to you if you work your community with educational seminars. We have different programs taken from CMS. You can find them as well on the Medicare training programs and through the different carriers and different senior organizations such as National Counseling, the National Council on Aging, where these are programs that you can use as an educational tool, an informative tool in your marketing year-round. Just keep in mind, People, particularly after that first quarter, if they are heavy utilizers of medications, they may be getting close to that higher exposure because of the gap in coverage, and they need the information year round. It's also a great way of staying in contact with key community pieces or key community influencers that can help you market an area very, very effectively. Other things that Premier will do is, of course, because there are a number of Medicare supplement programs and other insurance programs that can help you address the needs once they've been identified, creating an agent profile insurance bay enables you to complete contracting for multiple carriers on an educational basis, or pardon me, multiple carriers on an electronic basis. I got education on my brain here. It allows you to do that much more simply than doing things on the old paper style of contract and submission. We also make available discounted errors and admissions coverage to agents. This allows you to act as a true independent agent because this coverage takes care of you on the programs that you offer, and you'll see the full range of programs, including variable products, which are not easily accounted for in errors and admissions coverage, but it takes care of that requirement placed on you by many of the carriers, regardless of who that contract is through. We realize that few agents have all of their business with one marketing organization. This takes care of you regardless of with whom you contract. We also make certain that you have a way of keeping your license in play as well through online continuing education bundles through our relationship with WebCE. And as an independent agent, you create your own benefit package. This enables you to access disability income insurance on a modified guarantee issue basis at a discount where you share the commission on your own product. Much as today's presentation is being recorded and made available to you not only on our website but on our YouTube channel, we do so with a number of different presentations that we make available, not only on products, but on different key pieces of information you need, like on LIS and MSP in greater detail. We have those as well, and on different marketing programs. These are available to you 24/7, and in addition to future live activity, you can go back and access the recordings on the different presentations that have been offered in the past as well. We do also offer you different pieces of electronic support. Our quoting tool for Medicare supplement and ancillary products through our contract with CSG not only allows you to quote these programs, but it is also having an e-app factored into it that gives you the opportunity to sell electronically very efficiently. We also offer the Medicare Center program for Medicare Advantage plans that give you an opportunity to collect that scope of appointment, which is still necessary. You still have to have it before you present. That 48-hour in advance requirement's gone away, but you still need to collect it and you still need to store it for 10 years. This is also a program that gives you an opportunity to compare the programs compliantly. This is the same company that fuels, we'll put it that way, the Medicare Plan Finder on Medicare.gov. It's a great way for you to also utilize it as a CRM where you can do your annual reviews based off the information you store within your version of the program. Gives you that opportunity then to do those annual reviews, not only to drive up the persistency with the people you've sold year over year, but also with those that you didn't. It gives you the opportunity, as long as you keep that right to communicate with them in play, of going back and re-reviewing their programs year over year if you sold them or not. We also have a program that makes your efforts on social media possible by putting it on autopilot through our Coverage Made Easy program. And we keep a compilation of all the incentive programs with the different carriers we work with in a singular place to help you track your progress with these programs, make certain that you receive all the compensation you're due, and keep you aware of the fact that we also offer our own program where a incentive trip from Miami to the Bahamas takes place next April. And if you are one of the sun worshipers, that's a trip to go for. We also have different lead programs that can help you if you are active in the Medicare supplement space and you still have a strong relationship with Ma Bell and like to cold call. We can help you with the contact list for that are butted up against do not call and available to you at either a low cost or no cost at all, depending upon your contracting situation. We can also help you with the sales tracks you need in order to maximize your efforts in retail marketing. Many folks with our organization are involved with Walmart or CVS or other programs through different insurance carriers. There are sales tracks for you to follow to maximize that effort. Nothing is more disappointing than having a dance and no one showing up. We have ways to help you maximize the value of your retail investment, be it the dollars in a Walmart program or just simply the time and space that you put into using that tool to reach out to the public. We have different programs also that help you access those centers of influence in the community, including faith-based organizations, the different presentations that I mentioned earlier, including LIS and MSP programs, explanations on Medicare 101. If you are a Medicare supplement person and that's your main thrust, well, presenting informational material on the different types of Medicare supplements and how they're being affected by MACRA going into 2020. Those are different presentations that can be made available to you many times in a venue that gives the person that confidence in you and the information that you are presenting, and they respond to where they won't other ways of media outreach. And then, of course, we got different programs to help you with marketing through providers, to and through providers. So that includes not only folks that are delivering the benefits you speak of through their medical background, such as doctors and hospitals and specialists, but also other individuals that are delivering care on different programs you offer, like dentists. So some different things that can come into play. And these programs are recorded as well and on that library of different presentations. Some carriers do offer different prospects moving forward, particularly Medicare Advantage carriers in certain markets. That does require a symbiotic relationship with that carrier. You don't do any business with them year round, and then in the fall you think they're just going to give you leads. Well, that might be a little bit of a, oops, not going to happen type of situation. We do also have different internet lead programs that we are offering as well. Facebook leads are really hot now, and we do also offer direct mail support based on production that can deeply discount the cost of mailings through our preferred lead vendors. All said and done, we want an opportunity to earn your business. And one of the things that we're going to do to start that is make certain that we answer all your questions. There's a request for a call from myself that will come to you later today. Leads at no cost or low cost, depending on your contract situation. Someone gets you the information on that, we most certainly will. We'll look at your contracting circumstance and get you some details. There are some challenges with different languages, unfortunately, but we're working on solutions for that. So all that said and done, watch for the follow-up to today's presentation. Determine that additional study on these assistance programs can be of value to you and your insurance practice moving forward, regardless of the segment of the market that you may concentrate on, or if you don't, having this information to generally apply across the Medicare spectrum can be very valuable for you. It's a question then of making certain that you get her done and in play. You can reach any of us through our toll-free number here at Premier at 1-800-365-8208 or through our website at premiersmi.com. We look forward to visiting with you in the very near future. And in the meantime, we wish you good selling. Thanks so much, and we'll talk to you soon.